Welcome. It's MC again with Healthy by George. And I'm so thrilled. I always am whenever my brother, who is Noel George, a 30-year practitioner in medicine. And I would love it if you would consider subscribing. We're here every Sunday and Thursday. And today we're going to talk about the phenomenal, challenging concept of this fatty liver disease. Welcome, Noel. I can't
Thank you.
tell you how excited it is for me to always have you on the channel. But I
Well,
do tell the
But
reason I really wanted you here because we've been talking about insulin resistance and then pre-diabetes, and then now there's this whole thing. Let's say, okay, you're not pre-diabetic and you are thinking about insulin resistance. This whole thing about fatty liver disease blew my mind. That 1 in 3 adults has some form of fatty liver disease in the world? That's shocking.
it goes to show you that we have a lot of hyperinsulinemia going on.
What does that
Or
mean?
that means that we have a lot of insulin resistance because our bodies are pumping out so much insulin. It's just not effective anymore because we're eating so many sugars. And one of the worst sugars to eat is fructose.
So fructose, when we think about fructose, I think we all think fruit.
Fruit, right? But it's the only type of carbohydrate that is metabolized in the liver. And
Oh,
and it is the one sugar that you really should cut out with.
but they tell us the Mediterranean diet, eat fruits, fresh fruits, vegetables.
Limited moderation. And that was the other thing too. When I heard the speaker talk about moderation, I said, what does moderation mean?
I think that's a hard concept because I think if people walk around hungry,
He recommended
nothing's
intermittent
moderate.
fasting. He also recommended less than 100 grams of sugar or sugar substances.
I'm going to tell
I
you
think that you
something.
shouldn't add any sugar.
Do you know how hard it is to not eat sugar? It's
It's
so
because
challenging.
actually, especially with grandkids around. Yep. It is very difficult.
You want to
And
have ice cream, ice cream. You want to have a treat. Even if I eat a yogurt or some kind of a milk product, I'm eating natural sugars.
I'll go a good week or 2 weeks and do excellent. And then I fall off the wagon big time.
What
And
is
when I
it?
do,
Off the
I
wagon.
regret it. I have a big old milkshake or something that's just horrible. And then I'm sick for 2 days because of the sugar rush and everything. The thing about fatty liver disease is that people with obesity, type 2
Mhm.
diabetes, insulin resistance, problems metabolizing sugar, they should be evaluated for fatty liver disease. The thing is,
So,
it's a very asymptomatic illness that can lead to complications in the liver that are horrible.
so what's that? So let's talk about that. So here it is. You've got too much insulin floating around. Your cells are resistant. So the fat or the
Well,
overabundance
you
has
have to go
of
back.
energy has to go somewhere, right?
What does insulin do? Insulin does two things. It opens the gate that lets sugar into the cell. It also prepares your body for energy that it might need later.
Use
So it
it. Yeah.
stores fat.
It's
So
stored.
once you've stored fat in all the places you can store it, sometimes it stores fat inappropriately around and in the liver. And
So
so
if
that
you're overweight, that could be something that's clearly a possibility is that you have some kind of fat stored in your liver.
and a lot of people think that it's more of an animal meat or the fat from an animal, but it's not. It's actually sugars are the culprit here.
Yeah. Yep.
And
Any
your
kind of
body
sugar.
doesn't know what to do with all these concentrated sugars, high concentrated corn fructose, all these sugar replacements, all these other sugars that I've never seen before in our foods. A lot of the preservatives, a lot of the food stuffs is so that the food stays emulsified or is fresh or the color's right. There's so many non-food stuff in the food now.
And sometimes it's hidden as a sugar derivative or some type of a combination carbohydrate sugar thing.
Did you notice the FDA does when it can say sugar free if it has a different type of sugar in it? If it doesn't have
If it has
sucrose,
a
so if it
like
has some other form of sugar,
maltodextrin is the biggest
some of it
one.
causes diarrhea, but it can be said sugar free. The
Yeah.
key thing is to know if you have what's called metabolic syndrome, asymptomatic fatty liver disease.
And so here it is. If we know, if you're someone who's obesity or you have obesity, and that's what can concern me. I'm overweight. I have a BMI of 30 or type 2 diabetes or you're pre-diabetic. Apparently, your risk of having this non-alcoholic fatty liver disease is 60 to 80%.
And actually, I didn't know that there were 3 minor or moderate symptoms when you do have fatty liver disease.
And what are they?
The first one is a dull aching up in the right upper quadrant of the abdomen.
Really? A dull aching?
Yeah, see, I thought
Somewhere?
it was. I'm
Like in your rib, underneath your rib
Yes,
cage on the right
most times.
side?
I wrote these down so I had because I was like, wow, I didn't know people actually have pain.
No, I've never heard of that
Me
either.
either.
Huh. So as you get older, you're going to have aches and pains, let me tell you.
Yeah. And do you know that people are like, can you eat bananas with fatty
It's
liver?
a
Well, they
sh
don't recommend
it's a
it because it
sugar.
has those sugars. Yes.
Yeah, it's a
Mhm.
total complete sugar, unless you maybe combine it with something. But the risk group is really hideous, 60 to 90% if you're overweight.
Oh, here it is. What are the 3 signs of fatty liver disease?
Yeah,
An aching pain in the top right of the tummy
okay.
over the lower right side. The second one is fatigue. And the third one is unexplained weight loss.
So fatigue, that's what worries me. Fatigue is this weird kind of symptom.
In the medical terms, when we use fatigue, it's the fatigue that is new and worse than any fatigue that you've had. So we have normal day-to-day fatigue from not sleeping well or tired from work or whatever. But they're talking about a fatigue that is significant change from the normal fatigues that you experience.
See, that still is okay. That's hard for me because I will go through the day and all of a sudden I just feel like the floor fell out from underneath me.
Fatigue you felt when you had the post-surgery?
Yes, that was pretty
You
rough.
cannot stay awake one more minute. That's extreme fatigue.
Yeah, you have to
You
lie
were
down.
actually experiencing post-loss.
Yeah. And so
So
that was very clear. And I
that's-
feel like
that's-
I've slowly recovered.
But that's the fatigue that would you explain. So a new onset of a fatigue that's so unusual or a new, extremely different than the fatigues you've had.
So it makes you want to go lay down right away.
Go lay down. You can't even stay awake. One of the things we always tell patients is with iron deficiencies, another thing, it's a fatigue, especially with low testosterone, a fatigue where you actually have to take naps now.
Wow. That's interesting. Because I think, oh, so here it is. You've got all this abundance of stuff and the insulin is now going to put it in your liver. Then how would you ever know that something's going on with your liver?
There are some tests that you can do besides scans and ultrasound. There are some tests I was reading that you can do to see if you have it. Let's see. Hold on one second. I'll tell you because I wrote it down. I didn't.
Well, I'm just telling, this is the thing. When you think about it, your liver is the place where really so much happens. It detoxifies your blood.
The liver is the most incredible organ in your body.
Yeah.
The
I
liver,
mean,
you can drop kick the liver down the street back and forth and put it back in your body and it will still work. The wonderful thing about the liver is you can actually cut the liver in half or kind of
and give it
one to somebody and it'll
still, it's amazing. It's a phenomenal organ.
When I was at the University of Miami, I was doing the hepatitis C research years ago, God, 35 years ago. And I was learning to do laparoscopic biopsies of the liver. Because when you just do a blind biopsy, you don't know if you're actually getting.
You can't tell where you're getting to get some.
So I would put the laparoscope in the navel and then look at the liver and take the worst spots. Oh, the liver was gnarly, dark, lots of dark patches, and it looked like somebody had fried it.
But that's when you have a disease state.
Yeah, these are very infected liver. But guess what? Their livers were functioning fine. As bad as it looked, they were doing okay.
That's phenomenal.
Because the liver actually is like one of those things where you go, and then it fails.
Oh, so it really will hang on for a long time.
A long time. So
yeah.
The first thing you'll see is inflammation.
So what does that mean? So that's why you're having pain? Is that what that's related to?
Possibly pain or fullness, because once you actually start storing fat in the liver, remember there's a portal circulation, hepatic circulation, Have you ever run and then you got that kink in your neck or something on your side?
Okay.
Run a long time. That's portal hypertension. And that's
What
when,
do you mean by that?
the blood pressure is really high in your liver.
Ah, and
When
so
you
you're
have
getting some
things
kind of
like you feel pressure, elevated
like a
pressure,
stitch in your sock.
a stitch in your side. And a lot of times you'll have a pain in the back of your neck, in the back of your neck. You'll feel it, or you'll
Hmm.
feel something here. And that's very common. It's called referred pain.
Referred pain from your liver
Yeah,
to the
it's
neck?
weird.
That's
Yes.
strange. Wow,
You never
okay.
had that happen?
No.
So when athletes, like when we used to run with all the equipment, football equipment, you would run with all this, and you would be, your pressure would be so high, it'd be so hot. You'd have a pain here, but mostly in the back of your neck because it was referred pain from your liver.
I'll be
The,
darned.
the
But see, here's
liver,
the thing. The liver like makes cholesterol, it removes it balances your hormones, your
the
estrogen, your
vitamins,
cortisol.
just think of all the vitamins
Yeah.
are so important, the enzymes. It actually helps stimulate platelet production.
Clotting
It's
factor.
actually clotting factor. It's incredible.
Fight
Not only that,
fights
it also
infection
creates bile and bile salts.
to help
It
you
clears.
digestion.
Our bodies are so miraculous.
It really is. That's why it's been how do we know if our livers are so critical to us? How are we going to know if this is the most common problem? And how are we going to know that? Does it show up as a lab problem?
They say the best way that they pick up fatty liver disease by how is fatty liver disease diagnosed? It's often diagnosed by blood tests called a liver function test. So if you do have abnormal liver,
LFTs,
pardon,
liver function
liver
tests, LFTs. Yeah,
LFTs, but it doesn't always. It doesn't always pick it up, and
really.
so usually you need an ultrasound. So if
Mm.
you have elevated liver enzymes and they stay elevated, even if they're just slightly elevated, and you don't have a viral infection or you're not drinking, there's a
Mhm.
because they're actually supposed to go back to baseline.
Mm.
So that's one symptom. The other one too is it doesn't always. I'm trying to think what else. What is the other thing?
I think the other thing are simple things like just like you said, they do say sometimes weakness. If you have some kind of fatigue and weird weakness that shows up, that might be related to fatty liver disease.
Usually, the most ways they do it, some blood test liver enzymes. The other one was imaging, T scan, and the third one was a biopsy.
The biopsy.
So those are all invasive, but a
Yeah.
scan. But
Well, the
if you
skin
are
is
elevated liver enzymes and you are obese or you have type 2 diabetes or you might have fatty liver disease, the first thing to do, the very, very first thing to do, stop drinking alcohol.
yeah, definitely. No
Stop
alcohol.
consuming any excessive sugar.
Yep, no
Start
sugar.
modifying your lifestyle. Get some blood tests. Consult with your doctor. The thing about it is it's suspected if the imaging is off. And the sad thing is that they don't tell you in the imaging. It's very difficult to tell unless you have a biopsy or do what's called a liver score. And they really don't do that often because it's a
So
calculated score.
so basically if they suspect you have fatty liver disease,
You should have an ultrasound.
you would have an ultrasound to see what's going on with your liver.
Because the
But
liver is
then
supposed to be, it's supposed to be throughout, it's supposed to be homogeneous. It's not supposed to
Mhm.
have any thickness to it. It's supposed to be
Oh.
smooth. And so if they pick up fatty liver disease, it's a warning that you need to make some major changes. Because if you don't, it's just going to continue to spiral and get worse and worse and worse. And then your
Yeah.
liver's going to more and more problems, and then it can develop into a tumor or develop into cirrhosis or fibrosis. There's
Mhm.
inflammation, and then it develops fibrosis and then cirrhosis.
Mhm.
And cirrhosis is truly dead liver tissue.
Yeah, because I know that some autoimmune diseases really destroy the liver horribly. And then ultimately you're facing a liver transplant in some way because your liver is so horribly damaged from the
Well,
autoimmune disease.
Couple of people that have had liver damage from alcohol and from and they get liver transplants.
They do.
I
But
had two
that
patients with alcoholism that got transplants.
wow, and they had completely stopped drinking?
You have to not drink for 2 years.
Oh, for 2
You have to be
years?
sober and active in sobriety.
Yeah.
They're very hesitant to give a liver transplant to an alcohol.
That's amazing. See, I think what
This
drove
was a
me
family donor.
Oh, it was. I think what drove me is, first of all, our father had diabetes. Who knows if he had fatty liver or not? Probably had some degree of fatty liver, but because I'm not sure what his lab work was. But I think that's what got me on this
His biggest
pathway.
problem was, if you want to just briefly talk about it, is that
Mhm.
he had hypertension for so long.
That's the worry for me too.
Kidney damage.
Here's my problem with hypertension, Noel, is I'm not hypertensive, but no one's really willing to tell me to come off the medicine yet for hypertension. My blood pressure hasn't gone so low that but I have moments and I wonder,
They're going to wait until your BMI is normal before they take you off.
so they have to see me below nearer to 25,
Yeah.
below
And then
30.
they can take you off, because and then you'll start having symptoms of hypotension. But the thing
Mm.
about it is, when your blood pressure is normal or even below normal, you're actually preserving the heart muscle. Too much work.
But what are you doing to the kidneys?
They're getting perfused. Trust me.
Oh,
They don't-
okay.
The problem is, over a period of time, atherosclerosis, hypertension also does damage to the
To
kidneys and
the
the heart and
in
the
the heart,
vessels.
the vessels. Yeah.
Sclerosis. And so when you
Mhm.
bring your pressure down, the kidneys will get perfused. If they're not getting perfused, they'll send out signals to make the heart pump harder. It'll make you hold more sodium.
I think the problem is that if you lose some weight, which is what I've done, I've lost a good bit of weight, 10% of my body weight. I've lost that.
And
I'm
your pressure
working.
came down.
My blood pressure has been normal. In fact, I came off the first 25. So I've lost a total of 50 pounds or so. And the first 25 pounds, I was on the blood pressure medicine plus a water pill. So I was clearly getting hypertension with that. I was getting dizzy. So we removed the water pill, and
So what is your blood pressure run now?
125 over 77 today.
And that's what it is first thing in the morning.
Yeah, first thing in the morning. It
And your
tends
heart
to
rate?
be the pulse is still somewhere between 89 and 90.
But never above 100.
Very rarely. Only if I haven't slept well. It might be 100, 101, my pulse. Because I don't sleep well sometimes, it'll be up. But typically, lately, it's been 77, 79, 89.
So what do you take? What do you take?
What is it? Loratadine? Losartan,
What dose?
100 milligram.
That's a lot.
I know.
Why
And
don't you
I
cut it in
really,
half?
it's too small to cut in half, but I'm going
They make a 50-milligram tablet.
I'm seeing my primary care doctor in June, and I'm going to talk to him about going in half and see what he says, because I think it would be a good thing, because every now and then I get weird dizziness. Like when I put my head down and come up, sometimes I'll get a little bit of.
And you check your sugar when you do that.
Yeah.
And it's
Yeah.
okay.
Mm-hmm. Yeah.
So let's get back to the fatty liver disease. One of the things about fatty liver disease, or
Yeah.
stage liver, or whatever, metabolic syndrome, asymptomatic fatty liver disease, is that if you find out early enough, you can reverse it.
That's what's so fascinating, is that I don't think about, here I've been overweight all my life. Everyone's focusing on diabetes, preventing diabetes, which I agree. There is no concern about, maybe that's because my liver enzymes have always been normal. They've never thought about.
And you have had ultrasounds of your abdomen and MRIs of your abdomen, haven't you?
Yeah, because of
So
my.
do you have any of the reports?
Yeah, I'd have to go back
So
and look.
it
Because
clearly says,
last year when I went in for that, where we thought I had the
So
blockage.
the radiologist will go down in detail as they read the
Mhm.
MRI or scan.
And
Whether or
it'll
not,
say something, right?
yes, it sure will. It will say significant steatotic fatty liver disease or whatever.
Oh,
You always say this about my heart.
yeah.
Significant calcified coronary artery disease.
Oh, shit.
Yeah, but it's not. It's just, I think because of the ablations and because they did
history.
2 heart casts on me and they're
Right.
clear as ever. But
Yeah.
that's what the MRIs always say when they read it.
That's interesting.
I've had an MRI of my heart. I've had 2
Do you think it's accurate?
MRIs are pretty accurate.
Yeah.
What they're seeing though is they're seeing on the MRI, they're seeing an image, they're not seeing in the vessel.
Right.
You can actually have a lot of calcium on those arteries, and they might consider it to be atherosclerotic. What's
Mm,
really important is that the heart function, the heart's getting plenty of oxygen,
yeah.
it's not being compromised.
What's a calcification score?
A fiber score. So a fiber score, it's a calculated stage of where your liver disease is placed by inflammation versus fibrosis versus
Oh, okay.
cirrhosis.
So it's
So we
like a
use things
staging of
like
damage.
so without having to do an echocardiogram, I
Mm.
actually use certain lab values to calculate a fibro score. It's
Wow.
not used in medicine a lot routinely because it's very complicated. You have to do labs, you have to follow.
Okay.
They look at that more when hepatitis C, another hepatitis C treatment to see if you're responding, whether or not you need to be on medications. But it is something you can look at. But an ultrasound or an echo is just as easy or quicker. They even have these new echoes that can tell
Mhm.
you at what stage of fibrosis or cirrhosis your liver is. But
Wow.
the gastroenterologists usually have those. The
Wow.
key is you're going to find out if you have fatty liver disease. If you do have it, if it's early, you can reverse it and completely turn it around. If you have
Well,
significant
that's what I've learned, and is that by losing the weight, which is I'm doing, eating a
exercise,
healthier diet, exercising more,
sleeping better.
so it's so hard to sleep better, controlling my blood sugar, which I think, or eating in the morning, not eating I'm eating savory meals. And even if I do eat the Ezekiel raisin bran, I don't add sugar. There's no sugar. I just drink almond milk with it. And there's no added sugar except raisins. Even still, I understand that you're going to control your blood sugar. You really don't need to consume any more than, I think they were saying, like, if you eat 5 to 9 teaspoons a day, something like that is all the sugar you should consume. That's not that much. It's
He driving me
very,
around some grandkids.
it's
I think wake up,
very
I'm like, he says, "Can I have Oreo cereal today?"
Oreo cereal, something like that.
Yeah.
Oh,
Oh my God, Kai is too much.
that's so horrible.
It is.
Oreo cereal?
I'm
That's
sorry. I'm looking at to see what the treatments are.
I don't the treatments are all initially
The
lifestyle.
treatments are geared toward controlling losing the weight,
Yes.
controlling your sugar, not consuming any alcohol, and they even are doing some experimental drugs with medicines that treat triglycerides. They actually,
Yeah, I've seen that.
and being monitored regularly by your physician or gastroenterologist, because that's who should evaluate you for fat.
So here's my problem. You only get one wellness visit a year. So how are you going to get monitoring for just, let's say you're just borderline, like me.
Borderline what?
Borderline because I have all of these risk factors. I have the risk factor of being overweight. I have some risk factor of some mild fatigue.
You have to see a preventive healthcare provider.
So, but then
You have to pay cash for that.
so then in order to really do something, it goes outside of your
Because
insurance.
our medical system is all on illness. It's not on wellness, which is
So
sad.
it's only based on, so in other words, if I really want to work towards, let's say I'm just in my mind, not that I know I have any evidence, but just because I'm in a category of risk, if I really wanted to understand more of whether I really have any early indication of fatty liver disease, I'd have to take it upon myself to go get the scanning or the ultrasound or
You don't
the.
have to take about your primary care doctor
Mhm.
and do some primary liver enzymes, primary scans or ultrasounds if they suspect you might have it. If you do have it, then that's considered an illness.
And then there
And
can
you
be
plugged
some
into the illness part.
follow up
If you
treatment.
don't have it and you want to get back to a healthier state of eating health, you probably need to seek health or healthier clinicians, not on the medical model.
Well, they call them functional medicine. I call it
The
functional
sad thing too
medical
is you
doctor.
don't realize that they just within the last 10 years started approving PSAs to be done by patients because
What are PSAs?
prostate specific antigens.
Oh,
testing.
really?
Yeah, Medicare would not do any screenings, but if you got prostate cancer, they would treat you. But no, you
They
got no
wouldn't
cancer.
scream to find out?
No, no, only if you had symptoms. You had to have a nodule or a mass or something picked up, and then they
Upon
would do
exam.
it. But they didn't do any screenings until the 80s or 90s. Yeah, they didn't pay for any, and they didn't pay for, what was the other thing they didn't pay for? A lot of time, many years, they didn't even pay for breast mammograms.
I've read that. I've read that many times with these things where you have a risk with factors, they don't pay for the mammogram.
Because the medical model was thinking at one point that most men will develop prostate cancer before they die, but it'll be so minor that they won't.
It's not, it's
The
inconsequential.
Medicare was like, we will treat it if you do develop the cancer. I'm like, why aren't we screening?
Because they
And
don't
so
care.
it's just the way that the concept. Once again,
Well,
the
you have to
clothes-
think about, I understand you only have one big bucket of money and you want to make it sure it goes the furthest.
Well, they used a lot of the money up in the 70s and 80s, but back to fatty liver disease.
Yeah.
I have seen patients with advanced fat. Oh, there's another thing too. Not only sugar, not only
Mhm.
alcohol, not only
Sure.
obesity, not only some medications cause fatty liver disease.
What?
Yes, I found
What
that.
medications?
Hold on, let me see if I can find the medication. I was like, wow, that's
I had
interesting.
no idea.
I said, this is very interesting. So
Yeah.
it didn't say what specific medicines, but some medicines do cause. I'll find out just. There it is.
They put you at risk.
Yeah.
Because of constantly
So
taking.
certain medications can also cause or exacerbate. That's all it says. Exacerbate.
So in other words, we don't know what medications. I just know that as we get older, it's like we have to take more time, more attention to our diet, our exercise, our sleep. Those three things really.
Well, look at also the consumption of alcohol at this.
You know,
5 years ago, they recommended 4
glasses.
4 ounces.
Yeah.
And then they said, no, 1 or 2 glasses. Now it's no alcohol.
Right. Because they've seen that how toxic it is for our brains.
And
And
most people
basically,
can't stop with 2 drinks, though. That's the biggest.
yeah, if you're in a social setting, it's like when the 2 drinks happen because they constantly are pouring it in your glass.
I want to tell you one story. We had a patient that was being treated for CLL. So we were scanning him about once a year. We were doing.
They had blood cancer, CLL.
Yeah,
Right?
yeah, it's a bone marrow cancer. And so it's chronic lymphocytic leukemia. And so we would do a PET scan if they had any changes in their lymph nodes or anything. But with CLL, sometimes you would do a complete abdominal ultrasound to begin with, because you do want to see what the size of the spleen is.
Oh, right.
And so this guy had been coming there for years. And every year he got his ultrasound of his abdomen and it showed the spleen wasn't any bigger. And they commented every year the same thing, steatotic liver. For some reason, he didn't hear us until the 3rd or 4th year of his scan. He said,
About the liver.
when did I get a fatty liver? I said, you've had a fatty liver now for about 4 years. And doctor has been telling you for 4 years that you need to modify your diet. No one ever told me I had a fatty liver. I said, 4 years we've been telling you. For some reason, he was so focused on the lymphoma,
The cancer, yeah.
that he didn't even, the word steatotic or fatty liver on the report did not mean anything to him until he found out from some friends of his that
what that was. I'll be damned.
He said, why didn't y'all tell me I had this? I said, we've been telling you every year.
But you know something? I think it's hard, Noel. If you don't have an advocate with you in the doctor's appointment, it can be so overwhelming as a patient to understand everything the doctor's telling you in that appointment.
And the other thing too is you're on a time. It's like the time's ticking away, ticking. Wait a minute, did I write everything? So we are so rushed in everything. We rush to the airport. We rush to the doctors. Everything's so rushed. It's, wait a minute. Why isn't there something before we see the doctor that's we have our list of list of questions, and just ask them questions that are important?
I think there's a lot of fear.
Answers, then we'll answer them the next time they come.
I think there's tons of fear. Most patients who go to the doctor, they want to just hear good stuff. We want to just hear, oh, you're doing great. Or, you haven't changed anything from the last time so or whatever. Or if you have a specific concern, I always go in with questions because that's just me.
Well,
I
my
have a
biggest
concern.
biggest beef with medicine was, and wasn't so bad in a more academic setting because a lot of the attending physicians would talk to each other or pick up the phone. But private practice, you have a renal doctor, then you have a hematologist, and then you have a cardiologist, and then you have a primary care doctor, and then you have an endocrinologist. Do you think they ever read the notes, or do you think they ever sit down and call as a team and say, I'm really concerned about this patient's blah, blah, blah.
Yeah, because I remember one time, well, back
We send all the notes out. Does anybody read them? Like
it's
the
too
chart, and that's
no, it's too much because I remember
right.
in
It's
20
too
it's too
much.
much because I spoke to my hip doctor in 2017 and I was overweight, much more overweight then. And I looked at him, I said, I believe I have a metabolic disorder. He looked at me like I was crazy. He said, Who told you that? He said, Who told you
Who
that?
told you that?
He asked me, Who told you that? I said, I saw my endocrinologist and she really believes I have undiagnosed PCOS. And he says, That's crazy. He told me that was crazy because he's an orthopedic. I don't know what that is.
There's no bones in it.
Metabolic disorder? What are you talking about? So I totally get it. So if you're someone who you're worried about diabetes,
Well,
you're
look,
worried about your metabolic disorders, you also know that you could be at risk of having fatty liver disease because you're obese.
one of the things that most insurance companies do have
Mhm.
is they have what's called a health nurse advocate that you
I
can
know.
actually contact. And it's with AI. And you
Listen,
can
Noel, I get called by this nurse contact for my health
me
insurance once a
me
week.
too, every
And
week.
what do you do?
Well, I
You
tell them, I
call
said,
them?
listen, I'm NB. I don't need anything right now. They want to know, am I maximizing everything so that my health is the best? Blah, 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 blah. And I said, yeah, is there anything else? I'm doing this and this. And I've been practicing medicine for quite some time. And oh, we're sorry. We won't call you anymore. I'm like, look at Mary Catherine, and I don't mean to deviate. Look at the explanation of benefits that comes in the mail to you. It comes in 18 different languages. It's so
Yep.
thick. How do you start? Look, what? I can't even figure it out. And I'm pretty smart.
I think part of the problem is, Noel, is we don't have a lot of knowledge around nutrition, period. I don't think people, and there's so many things in the people say keto, eat nothing but meat and salad. And then there's some people who say, let's be vegan and get rid of all the meat and just eat beans and
Well, they
vegetables.
are recommending getting away from animal protein.
Yeah, animal protein I know is an issue,
And
but
if you
it's
do eat animal, it shouldn't be so every day. The other
very,
thing
very
too is
limited.
we are instinctively hunter gatherers, and we didn't eat like we didn't eat this much.
No,
We would
I
have
think we
periods like
really have a bad concept about how much my partner is born with that French concept in mind. When I see how little he eats, it blows my mind. Like
and he does
just
that because
naturally, he naturally eats such a smaller portion
for
than
what reason?
it's how he grew up.
Yeah.
He grew up
See,
that
yeah, Americans eat till they're full or everything on their plate.
clean, and we like to see this huge, generous portion.
Yes, yeah. And they're like,
We
"Oh, put
want
it on your plate, everything."
we want to see
And
value on the plate. Lots of value.
remember, and even some of the diabetic teaching, Mary Catherine,
Mhm.
they do this thing where they divide the plate up in portions, and there's like a scoop of this, you can do that. I'm like, that's not what you should do. It should be small portions to see if you're even full.
That's one of the things I do like about being on this GLP-1 drug. For the first time in my life, I feel like I know what it's like to feel satisfied, like eating a half a sandwich and a cup of, or like tonight I had a half of a salad and I'm completely satisfied. So I totally, for the first time, because of this drug and the way that it works, it truly has helped me because I think when you have a food problem as early as I did when I was 10, it becomes
I think we
so
all have a food problem.
I think it was also complex. It was my our family was hyper vigilant. What am I eating? And there was all of these things about only give her a hamburger and cottage cheese and some vegetables. I'll never forget when that doctor handed me that little sheet of paper and it had literally hamburger patty, cottage cheese, salad. Those were the three things I could
I
eat.
love cottage cheese.
I do too. I think it's hard
Getting
because
back to
nutrition.
a lot of times we get so caught up in our jobs and in
Yes.
our lives that
Yes.
we forget about our health. And that actually is really the most number one thing that we should be thinking of, because when you don't have your health, you don't have anything.
Yes, I know. It's truly the truth.
And
So
so,
it's yeah, but where do you begin though?
good question.
Where do you
Sometimes
begin?
it's something as simple as Healthy by George, something as simple as Google, something as simple as WebMD. I don't know. You have to start somewhere.
Well, I think
I
for
think the thing you
me,
need to look at is you need reputable publications or reputable sources, not
well,
here's
I think if you look at, well, I like the glucose goddess. She talks about how
the glucose.
well, she's called the glucose goddess. She's the YouTube channel, and she's got a book she wrote, The Glucose Revolution. She's even created this natural substance where you can take a pill and lower your body's glycemic response to certain carbs.
Well,
I forget. I think she was
it
bio.
sounds frightening. What if she's
She's
reputable? They're together.
I do because she's a biochemist
And
who
she
was
developed the pill.
she developed it and she really sees amazing
And
results.
it's a pill that's actually a chemical.
It's a supplement. It's a
Well, I
combination
have
of
to tell you,
supplements.
I take a supplement, and if I don't take it, I'm ravenous.
Really?
The sour
Oh
supplement.
yeah, the sour sop.
I take it twice a day. My appetite is gone.
Hear me.
No, and my aches in my shoulder and my body are gone.
That's very
If I
interesting.
don't take it, I could eat everything.
Wow. Okay. So that's a
But I
good thing.
haven't put it to the test. I haven't checked my sugars while I'm taking. So I'm going to start doing that.
Yeah, because sour sop is a natural fruit.
This one has tons of stuff in it, but I don't want to leave you. But when I take it twice a day, like today, I had half a bowl and I had a little bit of salad. That's it. That's all I eat all day.
Oh, that's amazing. Wow.
I'm not hungry at all. And we went to Taco
Good.
Bell. The boys ate. I'm not going to eat that stuff.
Yeah, I can't eat Taco Bell. Sorry about that. No more.
I shouldn't say that on the on.
It doesn't matter. It's okay. You can have whatever opinion you want here. So here's the thing. I think if you are someone who's more prone to being able to change your diet, do that. If you're
Well, step
someone
back a little bit.
who's
And how much are you drinking? How much
me,
sugar are you
alcohol,
consuming? Yeah. No,
I
and just
don't.
in general, the questions you need to ask you: how much are you drinking? How overweight are you? How is your BMI? How is your blood
Yes.
sugars? If you said yes to all three of those, you probably should be able to say, wait, have you?
Yeah, that's the whole point. I've been overweight all my life, struggling. My blood
But you're not
sugars,
struggling anymore.
I still am not at the goal weight of being lower than
Just
30.
because you love those chocolate donuts. I just, yeah.
Donuts are an issue. Donuts are an issue. I
Kai has an issue with them too.
Donuts are really a challenge for me. I love a
I'm
good
just
glazed
teasing.
donut. But no, I think, you're right. It's like, where can you start? And I think it's if you can start with what do you do as your morning routine?
Yes.
Do you move a
Starting the
little
day
bit?
right.
Do you move a little bit? Do you do something for your stress?
But
Maybe a
that
little.
routine, developing a routine every day tells your body the
I'm
message.
doing this today. You set yourself up. I'm gonna
And you
do
have
what
to
I
do a
can
routine
do.
that's right for you, that fits you.
Exactly. Yep. And
And
some
that's
people are not morning people.
everybody says that everything I ever watch on TikTok and Zoom and all these other things, guess who's calling? It's mom. Everything they all say, develop a routine,
Yes.
do it. So listen, I'm gonna go.
Okay.
Thank
Thank
you
you
for
so
having me.
much. I
We can talk more
appreciate.
about this in the future, and I'll
Yeah,
just
I
do
think
more
what
research.
we'll do is we'll do a follow up to see what can you do as far as action plans. What does it take to change things? And I just always so appreciate our
Me
conversations
too.
about these kinds of complexities about our health.
I'm sorry I had to look up some things because I hadn't
No.
really.
I listen, it's to me, no, all the things about our wellness and our illness are so hard to remember and how to help ourselves. And I think you're right. If we can set up a morning routine of some kind that gets us in the frame of mind that my health is what is the most important thing that I'm gonna make sure is part of my life every single day. So be well, my friends.
Thank
Please
you.
join us
I
here
love
in
you.
Healthy by George every single week, Sundays and Thursdays. And please think about subscribing. That's what we want. Subscribing people. Please join us. We would appreciate it. Bye
Thank you.
bye.
Bye,
Thank
love.
you, my brother. Love
All
you. Tell
right.
mom
Love
I
you.
see
You
you.
know I will.
Okay. Bye. So thank you so much for joining me at Healthy by George. I hope you found the information inspiring and that it encourages you on your wellness journey. Because remember, your body, your well-being are a most precious gift, and every tiny action taken daily can make a huge difference. I hope the information here is educational purposes and is not meant to replace your medical care. See your doctor and talk about what works for you. If you enjoyed today's content, don't forget to give it a thumbs up and subscribe to my channel. Your support means the world to me, and it helps me continuing creating content that inspires and empowers you to live your best life. Goodbye for now, and join me again at the next Healthy by George.